Okay, I think we're going to get started. Good afternoon or good evening, depending on where you're zooming in from. My name is Kristen Siebert, and I'm the Program Director for Yale's Council on African Studies. For those of you unfamiliar with our work, the Council supports and coordinates the study of Africa within Yale University and promotes education and scholarly exchange about Africa through our curricula and educational activities open to the general public. We at the Council would like to welcome you back today to today's second of 3 workshop series, which are a continuation of our 2-day event on October 15th, 16th, Through the Eyes of She. Today's workshop is Perspectives from Women Leaders in Health and Healthcare in the Heart of Africa. Before we get started, we'd like to thank those whose generous funding has made today's workshop possible. The Edward J. and Dorothy Clark Kempf Memorial Fund, the Hakeem and Maima Belasagi Provost Fund for the Promotion of Africa, the Yale Office of International Affairs, Yale's Council on African Studies, the Department of Pediatrics Global Health Program, the Yale Institute for Global Health, and the Women's Faculty Forum. Today's workshop is being moderated by Dr. Ayotunde Uko, and our panelists are Dr. Ore Doherty, Dr. Kemi Da Silva Ibru, Dr. Lydia Mungerera, and Dr. Nneka Mobesan Etuk. Dr. Uko is a British-trained general practitioner, a CEO and creative director of the luxury fashion accessories brand Ayauko, and a women's advocate serving as vice president of the board at the YWCA La Crosse in Wisconsin. Her global experience spans business management, strategy, healthcare, quality, and clinical medicine. She is also a Yale alum, holding an MBA from the School of Management. Dr. Kemi Da Silva Ibru is a consultant specialist in obstetrics and gynecology, as well as a public health physician with over 20 years experience in private practice. She's also the founder of the Women at Risk International Foundation, a nonprofit organization that addresses the prevalence of gender-based violence, rape, and trafficking of young girls and women across Nigeria. Through this work, she has become a recognized thought leader in the field of women's health internationally, and her 2020 TED Talk on the shadow pandemic has gained a global audience. Dr. Ore Doherty is a US board-certified pediatrician and public health physician and founder and medical director of Ingress Health Partners. Here she's working on expanding integrated comprehensive primary health care, employing a continuity of care model incorporating anticipatory guidance and behavior change at community level, integrating this with technology and expanded partnerships to optimize maternal, newborn, and child health outcomes. She's also the founder of the African Children's Hospitals Foundation, established with the aim of significantly expanding access for children across Africa to quality specialty care at designated pediatric centers. Dr. Nneka Mobesan Etuk is co-founder and CEO of MDoc, a social enterprise that integrates proven methodologies in quality improvement and behavioral science with web and mobile-based technology to optimize the end-to-end care experience for people living with chronic health needs such as diabetes, hypertension, and cancer. Prior to MDoc, Dr. Mobesan Etuk was executive director for Africa at Institute for Healthcare Improvement, a leading global health organization focused on healthcare quality improvement, where through her leadership, IHI dramatically expanded its efforts at building sustainable change in healthcare delivery systems in priority African countries. A pediatrician by training, Nneka was previously vice president of community health and population health management at the Connecticut Hospital Association. Dr. Lydia Mungerera is a medical doctor and is well known as an HIV, TB, gender human rights advocate, and is founder and CEO of Mama's Club Uganda, a grassroots-based non-governmental organization founded to provide psychosocial support for HIV-positive mothers and their children. Mama's Club has mobilized and built the capacity of HIV-positive mother mentors to go out in the community and link mothers to healthcare centers for safe delivery for their babies. She's a member of the National Forum of Living People with HIV, the International Community of Women Living with HIV and TB Survivors Network. She's also co-founder of the Pan-African Treatment Access Movement and has served in various leadership roles within the Ugandan Ministry of Health on maternal child health projects. I'm going to now turn it over to Dr. Uko, but before I do that, I just want to remind everybody that you can drop questions into the Q&A at any time during the conversation. We will get to them during the Q&A. Now over to Dr. Uko.
Thank you so much, Kristen. Hello, everyone. A warm welcome to this panel. It's part of a special workshop series organized by the Council of African Studies at Yale, and we're so grateful. With me are phenomenal women who lead in health and healthcare in communities within Africa. Lydia, Kemi, Orode, and Nneka. I'm so thrilled and honored to share this panel with you today. We'll cover a number of topics relating to your organizations and the work that you do in your communities. The confluence of leadership and business in society has captivated me growing up in Africa. Today, you'll get a glimpse of this nexus through the reflections of these exceptional women. Join me in elevating them and their stories. Nneka.
Recording in progress.
Okay. Nneka, I'll start with you. There's an echo, so please mute if you're not talking. Thank you. All right, so Nneka, a warm welcome back to your Yale family. You're doing an exceptional job driving much needed basic healthcare to Nigerians, and you have received recognitions for this. You were recently selected and recognized by Ernst Young for the Meaningful Business 100 accolade. Also, MDoc, your company, recently got funding through the Google Black Founders Fund Africa. We are immensely proud of you. Now, both you and Imo, your husband, founded MDoc, and you're deeply committed to what you do. Why MDoc? Can you tell us about MDoc? What inspired you to build it and to keep building?
Thank you so much, Dr. Ayo. It's really a pleasure to be with these amazing women and with you as well. It's just phenomenal for me just to be on a panel with all of you, and also to be back at Yale. By far my favorite academic experience. So Imo and I co-founded MDoc largely, because of my dad. I mean, I think it's as simple as that. I share this often. My father was a hardworking, middle-class lecturer from Nigeria who wanted two things in life, literally just two things. One, to transform the technology landscape of Nigeria. He fundamentally believed that technology would unlock the seat that Nigeria deserved at the global table. And the second piece was to spend more time with his family, because the first goal was taking him away from us. But unfortunately, my father died prematurely from complications from a massive stroke that he had at the age of 52, largely because he did not have access to a team of providers to support him in managing his uncontrolled high blood pressure. And the reality is that was many years ago. And in my experience leading the Africa portfolio for a global US-based NGO, I realized that my father's story wasn't unique and that story hadn't changed. In fact, in many ways, it had seemed like it had become much worse, and just it was all around me. And so the combination of, honestly, impatience, frustration with development as we know it, the reality of colonial legacies on our countries and on our continent, the difficulties and kind of the impact that development policies, some harmful development policies have played in terms of healthcare systems on our continent. And the reality is that we were facing a chronic disease epidemic fueled by a culture of treatment-based healthcare as opposed to prevention and promotion, ultimately fueled and led to kind of the courage to quit my job, more or less give up, a great life, and do this with my husband. So we are all in. People think we're crazy, but that's how committed we are. My husband is living with hypertension and has, experienced firsthand what it means in terms of his life. And so we are committed to changing the narrative for our continent, but also showing that you can do it in a for-profit way. And we're just grateful. Thank you for highlighting kind of the support that we've gotten. And I just want to say, we're incredibly grateful to all the folks that have supported us and are working with us to help us collectively change the narrative for Africa. Thank you.
Thank you. You brought up a good point that you come from a background of technology. You yourself have technology in your career, right? From that perspective, can you talk a little bit about the unique services that you provide to your population? Because you bring this nexus of technology and healthcare together.
Sure, very happy to. So my background, I'm a mechanical engineer turned pediatrician, right? So, and I lived, I was told I had to be an engineer when I was young, right? So technology is, we live and breathe it. And Imol, my co-founder and husband, is an engineer as well. And so we recognize the role that technology can play. And so at MDoc, we leverage essentially what we call a 4-pillar approach to provide integrated self-care support to people living with chronic health needs, such as cancer, such as diabetes, et cetera, as you've highlighted. So what does that mean? The first is that we connect people who've already been diagnosed. I say that with a smile because, quite frankly, there's such a lack of diagnosis in our communities. Actually, we've ended up helping people, probably at least 80% of the population we serve today get diagnosed. And that's about 53,000 people on our platform today, where they are connected with virtual coach-led multidisciplinary teams, essentially nutritionists, fitness coaches, et cetera, who support them through our omni-channel digital platform called Complete Health. Complete Health is AI powered, but it also integrates with WhatsApp, Telegram, SMS, voice, et cetera, because we recognize that the people that we serve, mostly people living with less than $3 a day, really struggle with digital literacy and need kind of that omni-channel support so that we can truly meet them where they are. The second pillar is Navi Health, which essentially helps people navigate and identify quality in-person care when they need it. It's a feedback review system to guide them. The third piece are our MDoc Nudge Hubs. So we recognize, as I highlighted just now, that smartphone penetration rates and mobile phone penetration rates are not appropriate proxies for digital literacy. So we've essentially created health kiosks in partnership with community organizations and hospitals so that people can walk in, meet with a coach in person, learn how to onboard onto the digital platform, track their metrics live because many of them cannot afford devices, and get support in that way. And the fourth and final piece is teleeducation. So we wanted to increase the likelihood that, we support people that 99% of the time they're out of a healthcare facility. But we wanted to increase the likelihood that when they got to a health facility, they would receive the right kind of care at the right time, in the right manner all the time. And so we partnered with University of New Mexico's Project ECHO. We're so fortunate to have amazing hub experts like Dr. Orade Darty, who essentially help to train and teach healthcare providers, doctors, nurses, pharmacists, and so much more through teleeducation, and that's really been phenomenal. We've recently expanded to Kenya and have just received support to expand across the entire continent to really build capacity in teleeducation for organizations in pursuit of improving capacity in our healthcare providers. So all of that together is this integrated quality platform to really support people in living their best lives so we have a healthier, happier, more productive Africa.
That's awesome. Thank you so much. Now, in a couple of minutes, can you, talk a little bit more about your organization? So you're a woman and you're leading this organization, you're CEO of this organization. Can you please speak to some of the challenges perhaps that you faced navigating this business and, how successfully, you've surmounted them?
Yeah, I think there are unique challenges being a female entrepreneur and being a female CEO, working on the continent. I think obviously I would have these if I was also based in North America, but I think there are unique challenges that are a factor of kind of our culture, the history, that we all live with today, and also being in technology specifically, right? So there are very few women historically in technology, and trying to be intentional around kind of, our desire to ensure that women are really continuously have a seat at the table. I'm met with challenges every day. But I would say that, for me, the challenges have been really around fighting kind of the stereotypes, the disbelief, just in terms of that women-led organizations, and so much more around that. I've also, to be frank, leading a company with my husband. It's been challenging in terms of even our staff recognizing me as the CEO. And that's just a very honest, it's very honest. And we've had very open conversations, I think, at a company level with all staff, really trying to highlight, our desire to have a flat organization without hierarchy and with a recognition that all gender, female, male, and more, we are equal. That takes a lot of intentionality, and it's a continuous journey. Do I wake up frustrated? Do I have to correct? Does my co-founder and husband have to correct? Almost on a daily basis. But it's a journey that I'm willing to take, because we have got to change the narrative for women-led companies across the world. And I'll stop there.
Thank you, Nneka. Thank you so much for sharing what you do. Lydia, I'll pivot to you next. Now, access to essential healthcare services is a challenge in African countries, and socioeconomic and cultural factors play a major role. Child marriage, for instance, prevents girls from obtaining an education and stunts their economic prospects in adulthood. Economic constraints and political priorities limit the resources allocated to maternal health, family planning, and education. Lydia, you are a physician and founder of Mama's Club Uganda, and your story of resilience and advocacy for others living with HIV in Uganda and globally is an extraordinary one. It deeply inspires me, and I'm sure countless others. Could you tell us, what is the inspiration behind Mama's Club Uganda? What is your role in it? And what are the important services that you provide?
Yes. Can you see me and hear me very well?
Yes.
Thank you. Okay. Mama's Club Uganda was an organization I founded. I don't know if you want me to go back to my journey of my life, or I just start with Mama's Club.
Please share your journey. Please share your journey.
Thanks. Thank you so much. In 1997, ending of 1996, I was diagnosed with HIV, and I was not even living in my country. I was working and living in another country. In June 1997, I returned. I was brought back to Uganda on my deathbed. Actually, by the time I got here, I was taken to hospital and found with a CD4 count of 1. CD4 count of 1, which means that you're actually ending your life. So I struggled. So through the struggle of my family, the antiretroviral drugs I managed in 11 months. It took me a whole year to recover, and here I am now. So well enough, I joined the AIDS support organization TASO, which is one of the first AIDS service organizations sub-Saharan Africa. And then later on, I founded the Mama's Club. My journey has been long. When I joined the AIDS support organization, I was working as a part-time doctor. At the same time, I was doing counseling to people who are living with HIV. And by that time, I joined the international. We started a big movement of international advocates to get treatment for people in Africa. Because at that time, if you remember, the antiretroviral drugs were not available. And even a few people were getting them from other countries outside Africa. So in that span of time, we formed the International Treatment Preparedness Movement and coalition, and we got all the activists from all over the world, joined by activists from America, who helped us a lot in trying to discuss with drug companies and trying to get drugs to people. So treatment came, through our networks, we formed the Pan-African Treatment Access Movement. We are the founders, and a number of negotiations, advocacy, activism took place to get treatment to Africa. So while I was working in international treatment, as I worked in TASO, the AIDS Support Organization, I realized that the group of mothers was not really paid attention to, because we were treating clients at that time, and by that time antiretroviral therapy had come to my country, but we were not looking at the psychosocial issues of HIV positive mothers. So I founded this grassroots initiative. It started as a community-based organization in 2004, and later on it grew into an NGO because we started the networks all over the country, basically to look at psychosocial support for HIV positive mothers, to talk about life skill building, to tell them more about treatment, to talk to them about human rights. Many of them had undergone gender-based violence, some had been chased out of their homes by their partners, and they had been left with the children, and the children had been taken away from them because of the stigma, the cultural norms that happen in our countries and many other countries. It was the same in many other countries where there's gender inequality, where women are, where there's women are, there's the empathy of women. Women don't have rights. Women don't have voices. Women don't have economic empowerment. And that's what we added onto our program. So we started training the mothers in different skills. We started telling them how to reach out to other mothers, train them in peer education, how to train other mothers in how to look after their children. We brought in experts to talk to them, and we also gave them chances to start doing small income generating activities, so in order for sustainable livelihood. Now, while all this was going on, the mothers and their children we would go for treatment, because now treatment had come, and elimination of mother-child transmission of the virus had started. The treatment programs had started in our country. And with a big group of other civil society actors, we put in place a lot of policies and joined the Ministry of Health and other partners in developing these policies. Now, in my global work, and I was a program coordinating board member of UNAIDS, and also a member of the Global Coalition of Women and AIDS. And in that respect, we also came up with accelerated agenda for women and girls in Africa. And we used to go to Geneva and build up that guideline, together with many other guidelines that we were building. And then we co-founded the Athena Network in New York with a group of other activists looking at sexual and reproductive health and rights. And all this was relating to my work in my country. So within policy, I joined a lot of regional networks, and we founded the Pan-African Positive Women's Coalition, also bringing together women living HIV all over Africa. So in my work, a lot of advocacy, a lot of global policy, a lot of grassroots initiatives, basically looking at human rights and gender rights for women. And that is when the mothers in my networks said that, you're talking to ourselves, and we as women, we are disempowered when we get to our homes. We have partners. Can you please start talking to our male partners as well? So it is in that respect that we started forming the men engage activism, engaging men and boys and engaging male partners. And we formed the father groups. Of course, it was not so easy because of the social gender norms that occur, cultural norms that occur in our countries. But we did start forming the male action groups and male champion groups. And in that way now, at this moment, I'm also a member of the Men Engage Africa networks, and I'm also a member of the International Men Engage Board. So a lot of work in activism, basically building the empowering women socially, economically, and also in the area of human rights and knowing their rights. But the mother networks are there in the country, and they're scattered all over different regions, each network with its own unique issues, because not every region of our country is the same. But at the same time, at regional level, I'm also a member of the WHO regional validation team, where we are validating countries. As you know the validation process. We're trying to come to this is in the area of PMTCT, so that some countries, and especially recently Botswana, came through in the path to elimination, trying to eliminate the mother-to-child transmission of the virus. There's a lot. There are a lot of work in there. I can't even piece it all together. But if there's any question that you would like to ask me, I'm very available to answer.
Thank you. And you've covered a lot of the questions that I was going to ask, so I really appreciate it. And it's amazing and quite extraordinary what you've done in this sector. I want to ask now the future. What do you see for the future of the organization? And the younger leaders coming up, how do you reach out to them and engage them in this amazing work that you do?
Okay, to begin with, amongst our mother networks, we now have a lot of young mothers as well. Unfortunately, our country has got one of the highest rates of teenage pregnancies at the same time. So we're trying to, to engage young mothers, and we are trying to build leaders amongst these young people as well. We also have a youth wing, and we are trying to build to mentor the young women to also become leaders in our field. And we have actually trained. We have trainings for young women and young girls, and we train them to also speak out like we are speaking, especially in the area of human rights. A lot of areas of gender rights and human rights to fight gender-based violence, and we train these young people. So we are passing on the mantle to younger people, and we also train them in the area of how to engage community gatekeepers, how to engage policymakers, and how to influence policy in our country. We also engage them in how they can reach out to other young mothers and other young people. And we also teach them how to speak out in public. So we are actually mentoring young people in our organization, and we really hope that that they'll take over as leaders. The leadership skills are there, the advocacy skills are being given to them. We are also teaching them how to live positive lives, because it's very difficult sometimes for young people to live positive lives, and we want them to live positive, but also to create the networks. So within our networks, we also have young networks for young mothers as well.
Thank you so much, Lydia. Really appreciate it. We'll talk a little bit more later on the work that you're doing. I think it's a good segue now to talk to Kemi. So Kemi, you're up next. Now, physical security and autonomy are important factors in ensuring that women are empowered to succeed. For example, violence against girls and women, as well as child marriages, are indicators in this regard. A McKinsey study shows that Africa performs relatively well on child marriages, but it lags significantly in violence against women compared to the rest of the world. 19% of African women have been victims of violence from an intimate partner, compared with 11% globally. Kemi, you are an experienced obstetrician and gynecologist with over 15 years of exceptional work in this field. Over this time, you have worked especially with a cohort of vulnerable patients who struggle to gain agency and access to much needed care and services. You mentioned in an interview that in Nigeria, 1 in 4 girls experiences sexual violence before the age of 18, with more than 70% of these girls reporting more than one incident of violence. For the work that you have done, you have received many notable awards and recognitions, including a Woman of the Year award in 2019, and the CNN COVID Heroes and Newsmakers recognition in the African edition. So tell us, Kemi, what inspired you to build Women at Risk International Foundation, WARF? And what services do you and your team offer?
Well, let me start by saying thank you very much, Aya, for inviting me on this amazing panel with these wonderful women. I'm in awe of Lydia and what Lydia has been able to accomplish. And Neka and Orode, I know personally, and they know how I feel about the work that they do, and as themselves personally as women. As you rightly said, my journey started in healthcare, and that's a space that I'm still working in. My background, working in healthcare as an OBGYN specialist, my natural target patient population are women. So when I came back to Nigeria and started working in the public sector, I very quickly identified disenfranchised women that were brought into tertiary medical centers to receive care. And the underlying theme was always either domestic or sexual violence. Now, this was over 15 years ago, and there was very little in terms of essential services provided for these niche women. Hence, they're being brought into these public sector facilities. But then, unfortunately, the medical personnel in these centers were not sensitized or trained to deal with this patient population. So you have a scenario where you are in a country like Nigeria. For those that are not familiar, we are a West African country, most populated country in Africa, actually, almost 200 million people and counting. 49% of us are women. We're a relatively young country. About 60% of us are under the age of 24. So when we say, as you rightly quoted, 1 in 4 girls before the age of 18, what we're saying is over 10,000 girls every day, somewhere in Nigeria being abused. And then when you talk about what's available for them or to them in terms of essential services, we have a huge divide. The other point that I would like to raise before going further is the fact that in Nigeria, as with many African countries, we have very strong social cultural customs that lend to practices that unfortunately are harmful. And so you're living in an environment where a woman is in a patriarchy, a low middle income country, where she's subjugated even when she's not violated. And then you're living in a country with cultural practices that harm her on a daily basis. And unfortunately, she's encouraged to keep silent about it. Because very many a time, what would happen is families are more concerned with the facade of the family name. And so this is a shroud of silence and stigmatization that we see globally, but even more so through the lens of an African family and what's, I suppose, identified as that ideal woman. So when she's in a situation of abuse and she's seen in these public sector facilities, she's oftentimes met with suspicion. She's made to disclose publicly. Her injuries at best will be treated, but no psychosocial counseling is offered. And then what's worse is she's sent back home, and home usually is the place of abuse. And the cycle just repeats itself. And I would see this, and I would try very hard to intervene as best as I could in my medical capacity. And I started offering my services pro bono at the start of my journey in social activism. But then again, I would treat those that were in need of my services. I would take those in need of obstetrical care into my practice, and I would take those that were in need of further repair into the OR. But then oftentimes I would realize that there was more to be done, because gender-based violence, as we're all aware, is a multifactorial problem and has many layers. So starting the Women at Risk International Foundation for me was in response to this prevalence of rape, sexual violence, and trafficking of young girls and women across many communities in Nigeria and in Africa. And my line in the sand was an 18-month-old that had been so violently raped by her father that I had to take her into an operating room. And her family, unfortunately, were enablers. And I say this because when you're dealing with the dynamics of an abusive environment, many times you recognize that the mother in the house is also a survivor of gender-based violence, and violence begets violence. So it's a very unfortunate situation. In starting WRF, our mandate was clear. How do we assist and address this problem, but in a very deliberate fashion? And so we work under 3 primary pillars: the health pillar, education, and community service. With the health pillar, we needed to provide a safe haven for all girls and women that needed assistance and medical attention. And so the Rape Crisis Center was opened in the epicenter of Lagos, one of the 36 states of the country. And we started offering free medical care following a partnership with the Washington, D.C. Rape Crisis Center. So we had a proper template that was set in place. In addition to the medical attention and the forensic medical needs of the woman, testing was relevant, as well as offering the post-exposure HIV drugs and the pregnancy morning after pill if the woman is seen in a timely fashion. And counseling was very important, Ayo. We had to make sure that we offered not just the one-on-one counseling, but the group counseling, because many a time women that are seen in post-incident centers like ours usually go back home and the countries are socialized enough to assist her. But we didn't have this luxury. So she goes back home and unfortunately it's difficult for her to follow through in terms of continued counseling. The other aspect we had to look at was welfare. Women make poor choices because they're financially constrained. Women make poor choices because they have no home or shelter to go to. Women seek justice but don't know how to begin because they have no legal aid. And so these were areas that we also had to offer assistance. The center opened in December of 2016. We've seen over 2,700 beneficiaries since then. And we also run a 24-hour confidential helpline. With regards to the other pillars, our focus was on the prevention of the problem. And so looking at it through the lens of education, we all know the most vulnerable group are those formative years between the ages of 12 and 18. And so we started to design and implement programs that we were taking into secondary schools for that particular age group. We recognized that girls were in need of empowerment because girls are socialized in homes of abuse and are very difficult in trying to, if you will, educate when they have no appreciation of what's happening to them. We also recognize that boys were socialized in these same environments. And I am one of those proponents I'm one of those that would say that a big part, in my opinion, of shifting the needle on this fight against gender-based violence is including boys and men in the conversation. So we started to do that. We started to find out from these young boys how they felt about gender-based violence. And 1 in 5 would say to us they would walk away when we send out surveys when they see a girl being harmed. And so we started to introduce programs to change their narrative so that their thinking becomes more of a protector as opposed to a perpetrator. We had similar problems as seen in North America in universities. We would have the sex for grades, for instance, or we would have peer pressure from college students in many of our colleges. So with the partnership with the UN Women, we were the first to offer an online classroom for tertiary institutions across the country. And right now we've, I think, trained about 6,000 and counting from over 106 of these universities. And then the final pillar was recognizing, as I'm sure Orade, Neka, and Ayo, probably you will appreciate, that Nigeria is predominantly rural. 54% of us still live in rural areas with no access to technology, no access to platforms like this to hear about the work we do. So we had to take our programs into these settings, and we had to work with the stakeholders, the gatekeepers in these communities because of the trust issues. They were the natural custodians of the problems. So as an OBGYN provider, I appreciated the informal services the traditional birth attendant offered. And so we started to train the traditional birth attendant across the different communities in Lagos and in other surrounding states. And we started to appreciate that with the training as first responders to cases of gender-based violence, the referral rate increased to the center. Our 24-hour confidential helpline, the calls increased from women that were stuck at home in abusive environments and couldn't reach us. And then we looked at the police force and law enforcement, again, recognizing the need for gender sensitization in that gatekeeper. And then we started to train and educate those law enforcement officers in attending to these cases. And then finally, anyone living on the continent would appreciate the third gatekeeper, the religious leader. You cannot live in Africa and not appreciate the sphere of influence a religious leader has. I mean, he is usually the natural mediator of these cases. And many a time he comes with his preconceptions of the community's cultural values because he's never heard the other side of the coin. So this is what we started to do, creating awareness and sensitization workshops for religious leaders so that we could have their buy-in in addressing and tackling the problem. And last year during COVID, by galvanizing our gatekeepers, especially the traditional birth attendants, we were able to sensitize and reach 150,000 individuals. And this was particularly important because of the shadow pandemic that we started to see becoming more prevalent during the COVID pandemic. And this was an increase in the number of cases because women were now sadly trapped at home with their abusers, and children who had boarding schools as a place of refuge had been sent back home because schools had closed. And so in recognizing this and having trained our gatekeepers previously in our different programs, it was an ideal opportunity to go back and utilize their services in many of the various communities.
That's awesome, Kemi. I mean, in all you've said, you've answered the questions that I had as follow-up questions. So really appreciate the work, the amount of work that you do at WARIF. And I'll have a few more questions later on. But now I will transition to Orode. Thank you. Now, in countries around the world, laws outlining and guaranteeing the rights of women as full members of society show moderate correlation with indicators of gender equality in society. This is according to a McKinsey report. 3 African countries, Rwanda, South Africa, and Zimbabwe, at the time of the report, enshrined equal rights for men and women into law. These countries performed on average better than most other countries on gender equality in society. On the flip side, several African countries still have laws that explicitly discriminate against women. For example, in one country, there are alarmingly high maternal mortality rates with low levels of women's participation in their own health-related decision-making. For example, in this country, 66% of married women and married adolescent girls do not participate in decisions regarding their healthcare, particularly in the rural areas. Many laws are being enacted, but they're not enforced. And all this impacts on a woman's agency regarding her life. Orode, you are an experienced pediatrician and public health physician, and you have provided exceptional care to patients within communities in Nigeria and also during your training in the US. You are also founder and medical director at Ingress Health Partners, serving communities in Lagos, in Nigeria, and you're the founder of the African Children's Hospital Foundation. You have also been awarded a prestigious Vincent Londino Teaching Award for Resident Education for the recognition of your outstanding role teaching. You are also a fellow and a moderator of the Africa Leadership Initiative in West Africa and the Aspen Global Leadership Network. We're so honored to have you here. Now, Orode, tell us a little bit more about what you do. What inspired you to build the organizations that you lead?
Thank you, Ayo, and thank you for having me alongside my sisters from way back when, Kemi and Neka, and a great pleasure to meet you, Lydia. So first of all, like Kemi, my background is in medicine. So I studied medicine, and then I became a pediatrician, and then I went to the US and became a pediatrician again, if you know what I mean. And I think that in the beginning, I struggled with just being a pediatrician because it started to feel for me very stifling, because both here and in the US, because of the places where I worked, pediatrics was a way to meet women whom you didn't have jurisdiction over. So here we were, I had jurisdiction over the care of their children, but I heard from the mothers, and it's impossible for you to be in a clinical setting with a woman and not hear everything else that's going on. So if the child had burns, well, it's because they don't have a play space, and it's because they're poor, and it's because they're not paying their bills. Or if we have to write a note in the US, for example, for them to get their electricity turned back on, it's because they don't have a job, or because they've run out of time for which they can continue to get support. Everywhere we went, it seemed like I was a pediatrician providing care to children, but I was dealing with their mother's issues, and they were weighing very heavily on me. So initially, public health seemed like the thing I needed to do, because it felt like I could solve the problems that were being manifest from the community and from the public space by stepping into that space. And then we did, only to find that in spite of being in the public health space, the problems continued. And it became clear that when you saw a child, for example, for the first time, who was 6 years old, maybe had had a seizure, there was no history, there was nothing to go on, child looks very small, then maybe they don't have a birth certificate, so that 6 years is created, is a, you know, somebody arrived at the age based on when the child was born, who was in power, something not quite there. And here we were in urban Lagos. It wasn't like I was out in rural areas. These problems sort of were multiplying and took me, you know, followed me to the US almost, and came back, same thing. I worked in the HIV space for the first maybe 7 or 8 years, and the problems were the same. Women did not have agency. That was the bottom line. You know, women couldn't make the decision around ensuring that their children could get care. Everybody was talking about sickness care. Nobody talked about prevention. Nobody talked about knowing ahead what was going on. And it just sort of, it grew as this feeling that if we don't do something about primary preventive health care, there is no way we're going to ever have a solid healthcare system. The vast majority of Nigerians do not have the ability to pay for tertiary care. And so if we wait for their problems to manifest as tertiary level problems, we will be stuck with people dying. And that's what we see. So people die from purely preventable conditions. And NECA will tell you, every time you go and you do an outreach and you see 300 people, 30 or 40% of them would never have heard before that they had hypertension. Maybe 10% of them would have heard that they've had it before, but oh, somebody told me and nobody really followed up with me. So here you are, you have all of these issues mounting. Women won't go unless somebody gives them permission. or unless they have a little extra money in their pocket, and then they prioritize feeding their families. And, you know, it just became clear that we needed to do something about primary health care. So I started to spend time in the primary health sector. I did a lot of primary health care, just visiting, spending time, identifying where the issues were. And if you look at the data, you do the research, you recognize that Nigerians actually have voted time and again for the private sector, right? So most Nigerians receive care, first of all, in the private sector. Maybe it's not the organized private sector, maybe it's not the formalized private health sector, but it's the private sector nonetheless. So people have this idea about, I'm ready to pay for something. They don't necessarily have the capacity to pay very much, but they want to ensure that they have the ability to make a decision. And they voted with their feet time and again. Women would vote with their feet by going to, as Kemi brought up, to the traditional birth attendants to have their babies, or to the nursing maternity homes to have their babies. And so in our community in Ebutemeta where I work, which is high density urban Lagos, and we voted for high density urban communities because those outcomes are exceptionally bad. If you look at all the data in all of those places, in spite of their being close to health facilities, they don't make the transition into the health facility. So 7 out of 10 of them will not have the baby at the local primary health center. They'll opt for the traditional birth attendants, they'll opt for the maternity homes. At the same time, they don't know whether they have high blood pressure or whatnot. So we set up Ingress with the purpose of identifying two things were happening at the same time. Remember, we have a lot of brain drain now. There's a lot of flights. So doctors are leaving, so are nurses, but doctors are leaving in greater quantities, and we still have a reasonable amount of nursing care available. So start to identify and say, how about we think about Nigeria's task shifting policy? So Nigeria has said, we will ensure that certain health services can be provided by nurses. How about we start to look at those individuals and ensure that they can provide services in a franchise model? And this is what Ingress is we're franchising primary health care as a social enterprise in multiply across the country. We're starting with Lagos, yes, but really ensuring that we can provide primary health care at the level of the community, working with the community leaders and the community providers, traditional birth attendants, working with the maternity homes, and then setting up the nurses so that they can take deliveries, provide continuity of care. And we do this in a few ways. So we have the clinical care component with the nurses and with physician supervision, because that's Nigeria's policy. The nurses provide primary care, as do I, supervising them, but also they are working towards, so there's a lot of education going on. They're working towards themselves becoming independent enough to supervise other nurses, as well as ensuring that we can get continuity of care. So when babies are born with the traditional birth attendants, they refer them into us. We see them within the first 48 hours to make sure that the mother is educated around all of the things that will make for a healthy newborn period. We have not been able to move our newborn deaths in Nigeria for the past 30, going on 40 years. Newborn deaths have remained the same. We've done well with maternal mortality, reasonably well. We've improved infant mortality, but newborn deaths have continued to be high, and they stayed around the same number. So we're identifying pregnant women close to the end of pregnancy, making sure we're seeing them, getting them into newborn care, following the children up, ensuring getting all of their shots, and then making sure that they're not just alive, but that they're thriving, and then they're making it to school age and beyond. So that's a big part of what we're doing is newborn care. There's also the component of really educating traditional birth attendants around harmful practices. Kemi spoke to that, where she spoke about harmful traditional practices. There are a lot of those that go on. Many of them are so under the radar that it is you sort of need to be embedded, sort of sitting in the community and listening for what's going on before you start to know really what all the practices are. And so community engagement is an important part of what we do, in addition to providing clinical care. And then, of course, there's the clinician training. So I spend a lot of time training the nurses, and we're starting to also think about how do we develop the ability of people to come behind us, right? So here's me, it's one person, and Ingress, and we're hoping to expand, because we started, right at the start of the pandemic. Now I'll save that story for later. But when we started, the idea was that we would be able to expand, right? But even now, when we're expanding, we need to have people like nurses and resident doctors and people who are interested in the community follow up with us in order for us and them to be able to continue the work and to do this work. That's what we do in a nutshell.
Thank you so much.
I don't know if you can hear me because everyone seems frozen.
Yes, the connectivity is fluctuating a little, but I can hear you. Thank you so much. So we're going to move on to motivation and inspiration of girls and thinking about the next generation. So I'm going to ask each of you a question, and so if you could take it in turns to answer. So Nneka, you could go first, and then Lydia, and then Kemi, and then Orode. So what would you tell your younger selves in preparation for her future as a leader in health and healthcare? So Nneka, if you could go first, please.
I think my answer, people will may not, it's a little bit different. So I would tell my younger self to really read history. And I fundamentally, this has become so important to me as somebody who focused on technology, who wanted to demonstrate that I could be a female engineer. I went to Federal Government College Enugu, a secondary school in Southeast Nigeria, for those who may not know. And I took a class called technical drawing, and my teacher, whenever I got the top scores, he would always insult the boys and say, can you imagine how would you let a girl, get a top score in technical drawing, right? And not surprising that would, and so so for me, it was always about technology, and obviously the pressure and the belief of my dad as well. And so I dropped history. Didn't take it in secondary school. The books I read really weren't about history. And I'll tell you that if we don't know where we come from, if we don't understand the systems that have brought us to where we are today, as a woman, as a Black woman, as an African woman, it really can have an impact on our mental health, on our confidence, on our belief, and on our ability to drive system level change. And so I have been very intentional. I leveraged COVID to every Friday have, my husband and I did this and are still doing it every Friday, to have our daughters read about the history that they weren't learning about and aren't learning about in our schools and really anywhere else, right? About our continent pre-colonialism, pre-colonialization. About the great stories that and so about our own our hieroglyphics, our writings, all of our mathematics, all the amazing elements of who we are that we don't know about, and also about kind of all this intersectionality, just the role of gender and shaping or socialization and shaping gender beliefs and beliefs about women before we even come out of the womb. And how that has an impact on us. Because to be frank with you, between the Me Too movement, Black Lives Matter, and COVID, and having a lot of time to think, it's been very difficult, right, to process all these different elements at this point without having that knowledge of history. So I just encourage everyone, we have got, even in our staff meetings now, we integrate elements of knowledge about our history, right? Whether it's about Africa, whether it's about gender, because we believe this is critical in starting to break the stereotypes, breaking the chains, quite frankly, that have held us back as women and as African women. And so I encourage everyone to really invest in that, you know, with their children today. I'll stop there.
Thank you, Nneka. Lydia, what would you tell yourself? What would you have told your younger self? And if you could have a minute or so, because we're running out of time, so we'll have to be quick.
I think I'll tell my younger self, if I was still living with HIV at that younger self, and I would tell my younger self that I must, first of all, build my own confidence. I would tell myself about removing self-stigma and to go out, to reach out to other young people to actually to build their confidence and to empower other younger women and young girls. And if I was, and in the era of HIV, I'll tell my younger self that if I remove self-stigma from myself, I would help other younger people to remove stigma in the communities. And I'll tell my younger self that to reach out to the rural communities and find those young girls and find those young women and build their skills, empower them, and also to make them feel confident that they're worthy of being alive, and they're worthy of growing and of becoming better people. And I would also tell my younger self that you can't do it by yourself. You need to work with others. I'll tell my younger self that despite all kinds of stigma out there in the community, of people looking at you and wondering, why are you different from others? I would still tell my younger self that that I have the power as a young woman. I have the power, and that's what I'll do. And I'll definitely tell my younger self that you can't do it, that you have to build you have to build the confidence and empower other young people, especially with education, because we know very well that a lot of things happen with young girls and young women who are not educated. So I'll do that, and also build the social empowerment and empower the economic skills and economic status of other younger people. But I would also tell my younger self that I have to be teachable. I have to accept to be mentored by older people. I've got to accept to learn, and unless I learn, unless I accept to be nurtured, unless I accept to be mentored, that I would not do it by myself. That's what I would tell myself.
Thank you so much. Thank you. Kemi, your turn, please.
Okay, so I think it's important for us to remember as mothers that we are custodians of our children. I think as African mothers, being African children, you hear a lot of time that, I'm a doctor because my parents insisted that I become a doctor, and so on and so forth. In my case, I confess, I was fortunate. I didn't have that pressure. And so my decision was a decision that I chose. And I think if I look back and I'm talking to my younger self, I probably would say to her that she made the right decision. I think I would say to her, however, that she didn't appreciate the commitment that came with that right decision. I probably would be very practical about the hours, the years of training that's involved, because you did mention healthcare, Ayo, in my context of my conversation with her. I would say to her that it's a great privilege and it will come with great reward, but with hard work. Not many of us are fortunate enough to have what they love as a career. And I believe I am blessed because I actually have two careers that I love. I think I probably would say to her to lean into her spirituality, because your faith in God in my life has been an anchor. I would probably encourage her to look at other aspects of her life. It's not always about work. And stop trying to do it all and achieve that work-life balance. It's a myth. There isn't a balance. I would say to her to enjoy her moments, every single one of them, in her family, with her friends, travel. I will tell her to have fun, but I'll tell her whatever she does, she should always try and help. And if she can't help, at least do no harm. Thank you, Aya.
So
Thank you so much, Kemi, for sharing that.
so can you hear me and see me?
Yes, yes.
So what would I tell my younger self? The first thing I would tell her is that she should go ahead and marry that boy. That is the right decision. That's the right person. But definitely not to be afraid to start early. I think that I graduated from medical school when I was 21, and Kemi will tell you, everybody, when you walk in the room, they say, are you the doctor? So don't be afraid to square your shoulders and say, yes, I am the doctor. You know, I worked hard to get here. So, you know, you will respect that. I will certainly tell her to not be afraid of all the exciting things that are coming at her and which she wants to do, right? So there's a whole nother half of my life where I work actively with young people who are interested in going into public service. And I do that now in Kaduna, but also now it's going to be Lagos, West Africa. So that's a big chunk of my life. And I'm not, you know, I'm unapologetic about it. I love it. It has kept me young and kept me hopeful about the continent. So I would tell her to start that early and not be afraid to be this person who is multi-potentate, because, you know, they try to keep us in a box as doctors, especially doctors in Nigeria, and say, don't you know you're a doctor? And I don't know what that means, because I'm this person who can be so much and do so much. And like Nneka, I've come to love our history and I immerse myself. And I would recommend a book. It's called Formation. It's the making of Nigeria from jihad to the amalgamation. It's a must read. Everybody has to read that book if you're going to be a student of Nigeria. And I would certainly tell her to be intentional about being mentored.
Thank you, Derry. We have to move on. I'm being told to move on. And, you know, one thing that I'm just grateful for is that this session is being recorded. So all this is going to be available for those who've registered and for you to share as well. So thank you. So we'll move on to see what questions there are from our audience. A couple of comments. Anuli has said, thank you so much for putting such a wonderful panel together. So amazing insights. Kudos to all the amazing panelists. We have another comment and a question. It says, I love what Kemi said. And she has a question. She says, how do we as young women balance pursuing our professional goals while supporting and nurturing our families? So, you know, how do we as young women balance pursuing our professional goals while still supporting and nurturing our families? And if you could each take a stab at it. So perhaps, Kemi, you could start with it. Thank you.
Well, I think if I had the answer to that question, I probably wouldn't be in a position where I'm saying I never did and I still haven't found the balance. But I do think that it's important to recognize that it shouldn't be one or the other. I think it's a function of timing. It's a function of access. I think as women, we need to recognize, especially in my part of the world, that there will be pushback. It's not going to be easy. And unfortunately, yes, when you stand us next to that man, regardless of your qualifications, chances are that he probably will get the job. I know many of us have probably struggled with that broken wrong phenomena where it's very difficult to move from that entry level to that managerial level, so that we're even recognized for that senior management and executive role. And I think it's important to identify that you need an organization that is sensitive to that. If you're living in an environment where the challenges are not just being a woman, but a woman of color, then you have to recognize that the organization that you're working in has to assist you with that by being sensitive to that issue, not only recognizing it, but having accountability put in place. So we need to be more intentional, if you will, with our choice of workplace spaces. I think that would add to the sense of balance, because you certainly can't achieve that balance, and you certainly shouldn't have to decide on forgoing a family because you've chosen to become an executive. You can most certainly be one and the other, but perhaps pace yourself and prioritize what you should do and at what time it best suits you and your family.
That's awesome. That's awesome. Nneka, would you like to, take your spin on that? Oh, can you hear me, Nneka? Oh, you can't hear me? Oh.
I don't think Nneka can hear you, Ayo.
Oh, Nneka. Oh, okay. So while we're getting Nneka's volume sorted out, perhaps Lydia, could you have a go at the question, please?
Quite a difficult question, because I am, in my experience, being a young mother with young children, with young babies, with my husband just leaving home and going to live in a foreign country and work there without my parents, without my family, and doing day and night duties as well in the hospitals. It was quite a difficult thing, and the experience I had was not that, was very difficult. But somehow you've got to find that balance. It's very difficult. You balance the home, you balance the family, you have to have your husband, and then you've got your work set out for you. And the work we were doing was very difficult, working in the hospitals, day and night duties as well. I think one of the things that you've got to look at, is what is, how can you stay sane? One of the things I used to tell myself that, what am I going to do? And I had to find a way of setting a lifestyle which was organized, which I had to say, I have my young children, I have my family, and at the same time I've got my husband. But I think working together with my husband and being, having that rapport and having that communication, that help, seeking out for that help, as well as finding friends and people around you who can support you in your life was useful. I remember always picking up my phone and calling my mom and asking her that, Mom, this is happening. What do I do? But in a long while, you kind of find that balance. You find that balance. You find a way of organizing your life where you say, I have my young children, I have my husband, I have my home, and I have my work. How do I do it? And you organize yourself. And I think women are actually one of those species, or could I say we are the people who can organize ourselves best. And that's how we can organize our homes. And you find that balance. But always remember that you have to have time for yourself. You also have to think about yourself, yourself as a person, so that you can maintain that sanity. I don't know what else to say.
That really helps. Thank you. Some of those points resonate with me. When we're talking about balance, it's more like a juggling act for me. I have to say, each ball is as important as the other, and it's, navigating and finding, finding space and prioritizing each at various times. So, thank you for sharing that. So, Nneka, are you on now?
I'm on. Can you hear me?
Yes.
Okay, so yeah, so I mean, I completely agree with what Kemi and Lydia have just highlighted. I think I would only add one, and these are all pieces of advice that have been given to me by people in the past. So one, I guess even to Lydia's point, don't be afraid to outsource. Okay, you don't be ashamed of it. Don't let anybody make you ashamed of it either. That does not define you as a woman, right? Whether you can clean, whether you are messy, and I say that speaking about myself, right? Apparently, when my father, who was very pro-woman, said to my husband, when he said to my husband when we first got married that if your house is messy, there's a woman in the home. If your house is clean, there's a woman in the home. My father said that. Okay, so just to tell you, I mean, just social norms, expectations, and don't allow that to influence who you are and what you do and what you believe in. And I'm a staunch believer in that. So many years ago, someone told me this: look, do not be ashamed to outsource. And then I learned this actually when I was in consulting as well, which was, leverage your brain, leverage your time for other things that you can, that are important to you or you value. And then if you have the ability to leverage support in, for other areas that you're not so good at, right? So I'm not so good at cleaning. Let me be honest about that. The second piece is surround yourself with people who believe in you, right? My husband, my co-founder, believes in me, okay? He knew who he married, a very opinionated woman who had big hopes and dreams for her continent, right? And he did too, and so we're doing it together. Does it not mean that people in our circle who say things such as, why is your wife the CEO? Absolutely. Does it, do they, just say things that may cause some level of tension in a relationship? Without question. But fortunately, I have been blessed to have a partner who doesn't get affected by those things. So I have that support, but I also have an incredible network of women who believe in me and who I hope I support as well. Empowered women empower women, right? I will say that over and over again. Empowered women empower women. It is our duty to empower each other, whether it's on your personal life, your journey as a woman, right? Whether it's in your professional journey. I have so many amazing women around me that struggle with insecurities, struggle with confidence, are surrounded by family members or friends or other folks who tell them that they can't achieve. And when that happens, I will just say, try to, where you can, drown those people out, to be frank. Find people who believe in you. We are here to help each other. The research shows it. Women-led companies, women-led organizations have much longer lasting impact on the communities in which we work. So we have got to support each other at home, with our families, and out there, in the workforce. And then the third and final piece is that balancing act is really about patience with self, which I think you've heard from both Kemi and Lydia, which is, when I was at McKinsey, my then mentor, when I had my first child, she said to me, look, your idea of yourself as a working mother will evolve. Be patient, right? Who I was then, I had this great vision of, being this wonderful consultant, and then I got pregnant and I was like, oh my gosh, what happened? I was stressed out beyond belief. But her telling me, be patient with yourself, it's a journey that has been with me till today, right? The needs of my children have changed. My needs have changed. And I'm being patient with myself and doing all I can to find that balance, and knowing that some days I'm not going to have that balance, and it's okay too. I'll stop there.
Thank you. Thank you so much. I think I've gone through everyone. Already, have you had a turn?
No, I mean,
okay, go for it.
I would certainly echo what Nneka has just said, as well as what Kemi said earlier and Lydia. I think for me, I was sort of opposite. I was never shamed into or socialized this way. I grew up with a strong Amazon of a mother, and she balanced as well as she could with a lot of help, friends, family, outsourced, people living in. So that was not strange to me, and it has been with me. So I have an army that supports me, and I've always had an army that supported me. Even when I lived in the US, my husband was a one-man army. Like, he literally ensured that no balls were dropped, and he moved, you know, several states over just to make sure that my work, my career could take off in the US, because we moved from Boston to Pittsburgh so that I could start on this journey. So I think it's Ibukun Awoshika who always says, and I want to leave this with every young woman who's listening, you have to marry the person that supports you. You cannot, the most significant success factor that many women will have will be the spouse that they marry, or if they choose to marry. Because if you do not marry the right person, and I'm saying this with a great sense of, you know, recognition that there are many people who may feel, you know, they may check all the boxes, but this person really keeps saying to you, but I really want poundodiam every night. And you know your work is, your life is not going to allow poundodiam every night. You've got to think about that decision very carefully. So that's a very important component. And for me, I think I was blessed because my mom took one look at the young man who was going to marry me and said, yeah, that one, I suspect because he pays attention to you. So that's one. And then the army, the people around you. And then, you know, when it's too difficult, you have to take care of your mental health, step back and determine what you're going to shape and press forward. And like Neka said, you have to be patient with yourself. Our needs have all evolved. We're talking about menopause today. Things are changing. So we just have to be moving on with it. Okay?
Thank you, Orode. Thank you. Kemi, you have your hand up.
I just wanted to quickly add everything that my lovely, wonderful women here have said, but it's also important to remember that some women may choose not to marry, may not have that partner, and that's okay too. This is not a prerequisite for you to be able to have the balance and to have it all. As we rightly said, find your village. Your village is around you. It does not necessarily have to be the person sleeping next to you. And so it's also very important to remember that your village, your outsourced help are those that are around you, that believe in you. And in so saying, I think it's important to finish by saying, we may not be able to balance, but exactly what Ayo said, we can certainly be that great juggler.
Yes, thank you so much, Kemi. Now, there's one last question that's come up about imposter syndrome. Oh, and Orode, please share the title of the book that you mentioned in the chat. I think everyone wants that title. But there's a question, it says, just a quick one. So maybe, Neka, if you could quickly say this one. It says, we know many women have battled with imposter syndrome at one time or the other. What is your advice regarding this?
So as many women have battled, men have too, right? They just may not say it. They may, just to underscore that piece. So I learned, someone shared a while ago, this statement. So not fake it till you make it, but fake it till you become it, right? And there's a wonderful book, and I'm completely blanking, but it's by I think a couple of Harvard professors around even the role of, I think it demonstrates that even just, you smiling or leveraging kind of physical actions can help you believe in yourself more. It has an impact just from a neurocognitive perspective. If I remember the book, I will share it in the chat. But what I have found to be helpful, and I shared this actually with my daughter who was preparing for a presentation the other day, it is that. It's I tell myself, because that imposter syndrome is real, okay? But I say to myself, okay, I'm about to go onto a movie scene, and that's I really want to be on Nollywood. I've always wanted to be an actress, just as a side note. So I tell myself, I'm going onto a movie scene. Whenever I feel that way, whenever I have any self-doubt, whenever I'm questioning whether I know something enough or whatever it is, I'm going into a movie scene and I am acting, okay? And what that has done for me is just made, has made me much more comfortable with actually being uncomfortable, right? I'm not going to know everything. I don't have to be an expert on everything, right? But I've gotten comfortable with that piece, and I think that's what I would encourage women who and people, not just people who battle with imposter syndrome, is we all of us feel it, right? All of us feel it, and so if you literally just, I'm telling you, this acting piece has helped me. When I went into consulting, I learned this too as well, and this was a woman leadership course, a gravitas course for women, around actually just tell yourself for that moment in time, you are acting something out. And what it does is just makes you so much more comfortable, right, with the unknown. We have been trained so much that we have to solve problems, that we have to take control, we have to manage what's happening in the kitchen, manage our children, manage everything else, and just be problem solvers for the world. And so when we're not, or we don't have the confidence, or we don't have the knowledge to be a problem solver in a certain situation, it makes us really uncomfortable. So I would just encourage trying that and see, does that help you kind of with that discomfort? I'll stop there, Aya.
Thank you so much, Nneka. Now we really have to wrap up. So I just want to say thank you so much for all of you. Thank you so much. This has been an amazing time, and it's been truly an honor. And, with the synapse of business and leadership in society, it's clear that women play a truly strategic and insightful role. We all look forward to Africa with its fullest potential realized for all of us. We can harness this value sustainably to create African nations that thrive. This is a glimpse of Africa that we are so proud of. I want to thank you, everyone, for attending, and to my wonderful, wonderful panel today. I have chills down my spine. Thank you for joining me. It's been such an honor. And with this, I'll pass it over to Kristen. Thank you.
Yes, just to echo that this was an amazing panel. So thank you so much. I thank everyone for attending and participating in this, our second in the three-part series. The workshop is going to end momentarily, but I want to ask if everyone could stay put for a moment to fill out the survey, which is going to show up in your browser as soon as we end the webinar. So please fill that out for us. And just as a reminder that the final session of our conference workshop series will take place next Friday, November 5th at 12 p.m. Eastern Time. It is the mindset that makes the difference. So thank you all for being here. And with that, we'll end this.